is Maria Ortiz, and I will be discussing Simmonds disease throughout this presentation. By the end of this presentation, I hope to get you informed on what is Simmonds disease, causes of Simmonds disease, symptoms, and current treatments that are available for this disease. So what is Simmonds disease? Discovered by Dr. Morris Simmonds in 1914, Simmonds disease is the complete destruction of the anterior lobe of the pituitary gland. This disease is also known as panhypothyroidism due to the reason that it stops producing all 8 of the hormones our pituitary gland produces instead of a single hormone. The result of this causes a patient to lose complete function of the thyroid gland, adrenal gland, and the gonads. This disease is most commonly found in female patients rather than males. However, this disease is very rare. It is considered rare because patients with Simmonds disease are often misdiagnosed with anorexia nervosa due to the physical symptoms that Simmonds disease has on the patient. This will be discussed a little later in the presentation. There are many causes of Simmonds disease, such as blunt force trauma to the head. This can cause hemorrhaging around the pituitary gland and cause severe compression of the gland and may eventually lead to damage. Diseases such as tuberculosis and syphilis have also been known to cause Simmonds disease. This mainly has to do with the disease itself and the impact it can do to the gland throughout the course of disease. Tumors and cysts are known to grow around the anterior lobe of the gland and destroy the gland cells. One of the most important factors to know of the causes of Simmonds disease is aging. The reason for this is because one of the most notable symptoms is necrosis of the pituitary gland. Aging can also cause the pituitary gland to become deteriorated as age becomes a factor. A typical age range in which this is seen is in patients of the ages of 20 to 45 years of age. Symptoms of Simmonds disease include emaciation, which is the appearance of looking thin or feeling weak, asthenia, lacking energy or physically weak, premature aging. Their skin appears pale in color and their nails appear to be dry in appearance. Their hair appears as normal, but thinning and loss of teeth due to the weak gum lining. A few examples of patients with Simmonds disease can be seen on the right side of the screen. One of the physical symptoms of Simmonds disease that is not mentioned in this slide is the appearance of being thin or too thin. As mentioned earlier, doctors had a difficult time diagnosing patients with Simmonds disease due to the fact that they appeared to be suffering from anorexia nervosa and would often misdiagnose patients with anorexia nervosa instead of Simmonds disease. This slide shows 2 images. On the left-hand side of the screen, a male patient from 1914 who was diagnosed with Simmonds disease is shown. Notice the resemblance of the physical appearance of the male patient to the patient on the right-hand side who was diagnosed with anorexia nervosa. You can imagine how doctors would misdiagnose patients who had Simmonds disease or anorexia nervosa during the 1914s, when the disease became known in the medical field. One of the known treatments for a patient who has Simmonds disease is the replacement of the anterior pituitary gland hormones. However, there is usually a downside to this. This is considered an ideal approach for doctors in the medical field, but by giving patients all of these hormones in certain dosages can also harm the patients. These hormones include adrenocorticotropic hormones, thyrotrophic hormones, and thyroid hormones with small dosages of testosterone for men. Adrenocorticotropic hormone, or ACTH, is needed for the patient to be able to regulate glucose, protein, blood pressure, and lipid metabolism. Patients who are admitted for treatment of Simmonds disease need ACTH to regulate their blood pressure because most patients have low blood pressure when they are admitted and cause the patient to faint or become weak with no blood flow throughout their body. Thyrotrophic hormones, or TSH, assist with making sure the body continues to produce thyroxine and triiodothyronine, which help in regulating the heart, metabolic rate, digestive functions, muscle control, brain development, and maintain their bones. Male patients who receive thyroid and testosterone benefit from this treatment, in which they are able to grow muscle, body hair, and maintain their reproductive glands throughout the treatment. Thank you all for taking the time to listen to my presentation, and I hope you all enjoy the rest of your semester.